important to include the medical the person who's involved in the medical care because they'll have to be aware of what you're trying to do. Um, if you want to consider seeing another doctor, well, that is something that you might want to think about. I said this is not something that we are really taught in the traditional lines of teaching. So so some doctors may be aware of it and some may not be. All right, so those are the persons that you need to speak to. The next thing that you want to do is to set a date as to when you're going to start, right? You want to set a date as to when you're going to start and ensure that you get the necessary things that you need. And of course, these include, of course, if you're going to do exercise, you get exercise equipment. You also need to make sure that you have your glucose monitoring devices and supplies. And you want to make sure that you have the necessary food in place. If you need to get your recipes and all of those things, you have to make sure that you get those ahead of time so that you can begin. There's some information that you need to have about the person who you're working with, and these of course include name, the person's name, the person's address, their age as well, or date of birth, his date of birth. You also need to get their weight. All right, so their name, age, date of birth, weight also. All right. You need to get how long they've had the diabetes, so the duration of the diagnosis. All right. Need to get that information. All right. I need to find out how many medications they're on for the diabetes, especially if they're on insulin. You don't want to know if this person is on insulin. All right. You need to find out if they have any other diagnosis. Right? If they have any hypertension, if they have any high cholesterol as well. Right? You need to also find out about their social situation. So, do they prepare their meals? Are they the ones that do their cooking? How much control do they have over their meals? This is critical information. You'd have some persons who don't cook anything at all. They may buy all their meals. That is important to know. Right? So how involved are they in their meal preparation? Is there anybody else in the house who has diabetes? That sometimes make it a little bit easier. Sometimes easier because of course you have somebody that you can work with. Right? You don't want to also know why they want to pursue diabetes remission, because this will go to the motivation. So what's the reason why they want to pursue diabetes remission? That's important for you to find out. If they're, and look at their lifestyle practices, are they doing any exercise? What are with their sleep pattern like? What is their water intake like? How much water are they drinking per day? If they have any affiliations, to any organization. So are they a part of a social club? Are they a part of a church? What kind of social connections do they have? Because these things can be helpful. I mean, as we have said before, being a part of these social groups can actually help you to give support when you're pursuing this kind of process. So you make sure that you get this information about the person. So you want to get their name, their address, of course, their contact number, those kind of information, date of birth, how long they've had the diagnosis, how many medications are they on, especially if they're on insulin. You want to find if you're on insulin. You want to find out how long they've had the diagnosis, they've been diabetic, any other diagnosis that they have, how, their home situation, if they prepare their meals, if it's somebody else in the house of diabetes, their reason for pursuing diabetes remission, and their current health practices, how much sleep they're getting per day, um, you know, their water intake, affiliation. If So question is being asked, what about the time they eat breakfast in the mornings? Well, yes, you can find that out. There's no harm. I mean, because you're gonna be having a conversation with the person. Because remember, when and this is why it's important to let them watch the video first, right? One of the first things to do is to let them watch the video, because when they watch the video and they see the things that they need to do, then they can identify the areas that they need to work on, right? So so when they watch the video, then you can get information afterwards, about these things that they need to get done. Okay, right. Any questions so far? Any other questions anybody has?
Dr. Street,
Uh-huh.
um, um, does it important for them to eat at a set time? For instance, they eat 7 o'clock in the morning once they're not on fasting, and say, when they have their next meal, say lunchtime or maybe further on in the day, is it for them to have a scheduled time when they eat their meal?
That would be ideal, because they don't want them to be eating one day 7 o'clock and next day 10 o'clock. So it doesn't have to be exact. I mean, if it's 7 o'clock or 8 o'clock, doesn't really matter that much, but they should try to eat at around the same time each day. All right.
Thank you.
One important thing that they need to really decide on as well is the approach that they're going to use, right? And remember that there are different options that they have, right? So remember that you have the plant-based approach, which is the one that I encourage, right? So they need to choose what dietary approach they're going to be using. So the plant-based approach is also the keto diet. You need to decide, which one they're going to use, the keto diet, or they're going to use weight loss, right? Right? Or they're going to be using the low calorie option, right? Low calorie option. So they can choose of which approach they want to use. This is important, of course. So you ask them which one they want to use, right? You want to encourage them, of course, to use a plant-based, because this is the one that is most sustainable. And I would say, eventually, that's the one that you want to get them on. So they may start out using some other approach, and eventually transition over into the plant-based diet. And would have explained the reason why that would be, because it is the one that is more sustainable, and which the one that has the most benefits. So no, the reason why you put weight loss as a separate measure, some persons do use other things to get their weight down. Yeah, there are medications that are used to get persons' weight down. Some persons use bariatric surgery, which is something that can help. So the weight loss is a separate intervention. I mean, the other things that they plant-based diet and the keto diet and the low calorie diet, those can bring about weight loss, but other things can bring about weight loss, right? So they decide on which approach they want to use. But you have to tell them how much weight they need to lose, anywhere between 5 to 15% of their weight, right? You would know that from the information you've gotten so far. So if the weight loss approach what they want to use, they can use it. Then there's a low calorie option, in which case you choose how much calories that you're going to be using, and we have discussed that already during the last session. So you're going to go for between 800 to 1500 calories per day, and for the regular person. And we'll have discussed if a person is a very big person or a very small person, then you might need to do some calculations. You might need to get me involved in that process to calculate how many calories this person needs, because the 800 to 1500 calorie is for the average person, right? Who is maybe I would say between 5, 6, 5, 7 up to maybe 6 feet. Those persons probably can go with that. But once you go very tall person over 6 feet, then you may want to do some calculation, because you don't want to cut this person's calories too much, but you want to cut it down to a level that will be effective. So they need to choose the approach from very early, what they're going to use, right? So after this person has started, um, the next thing that you need to do is to start doing some monitoring. So the first thing that you want to be monitoring is what you want to be checking on first after the start of the process.
It'd have to be at least I think the sugar level, like how well they're doing after 2 hours of eating. Given that you have started and you've implemented some things, you want to be constantly checking to see if there are any variations, so you know what is working and what is not working, and so you can do any tweaking if needs be. That is what I would do.
Yes, so definitely the sugar, you don't want to be checking yeah, from the same day. So doing a 2 hours is quite in order. For each of those meals that they have that day, you don't want to check to see what those are. And of course, so you would probably want to even do a whole profile. You should start off with a fasting blood sugar. So before they start eating that day, you want to check on that. And then each meal you check to see how much. And remember, we're aiming for 2 meals per day, right? 2 meals a day. So just sugar afterwards. And you want to also check the next morning. So the following day after the start, you want to check their fasting on that day as well. And that will give you some guidance as to how many checks you need to really do again. But what you can do generally is check every couple of days, right? Just to see where it's coming down to. And so for the first week or so, you want to check the sugar for every couple of days, just to see where things are, just to see how quickly the sugar is coming down, and be guided accordingly, right? So you should see some improvements in the readings, right? You see some improvements in the readings. Another thing, just backtracking a little bit, another thing that you'd want to also be doing in this process is recommending some supplements for them. So would have discussed the different supplements that can be used. So again, they have to see what is in their environment, what is in their area, and then you can choose what supplements they're going to be using. Certain supplements I wouldn't really want to start using too early. I would recommend you start off with one supplement, such as probiotic. The probiotic shouldn't bring about any immediate results. So I would start off with a probiotic in the first week, right? Because I said it won't really bring about any significant changes, right? And then in the second week, you could start off with an antioxidant supplement. So those include things like coenzyme Q10, reishi mushroom, turmeric, in one of those supplements, you can look back at the blogs on that to see which are the antioxidant supplements, so they can start off that in the following week. And then depending on if their blood sugar needs to come down some more, then you can start off with some of the ones that lower the blood sugar, right? So we're talking about things like magnesium, right? We're talking about even vinegar. You could look at it in the same. So the vinegar, as I said, can bring the sugar down, so you can use that as well, right? And the others that are there like berberine and so on. So you can use those in the third week if the other changes have not been able to bring it down. So you could add these in, but of course you'd have to look to see whether the person's already on medications, right? And remember, we're not going to go through all different things that we would have spoken about during the series. We'd have spoken about using the fiber as well. So each person should be taking a fiber supplement. You probably can start the fiber supplement, probably in the second week as well. So like your glucomannan or your flaxseed, your chia seed, you can start out that in the second week because I said you don't want to start off too many things in the first week. So you can add your fiber supplement in that second week. Right? This is something that everybody with diabetes should be on, but it's a matter of timing. So the fiber you want to add in the second week of the changes, right? So let me just turn off this alarm.
Doc, one question.
Yes.
I missed something. So I got that in the second week we introduce antioxidant supplements, right? Like the turmeric and the reishi mushroom, and we may introduce the fiber supplements like the flaxseed and the chia seed. The third week we introduce the magnesium, the vinegar, the berberine. But what do we do in the first week? Just
the first week. No, you can start the probiotic during the first week.
Okay, that is what I know I missed. Thank you.
Right. Yeah, because the probiotic, it will bring about slow changes, so it shouldn't affect their other interventions and bring up cause the sugar to go down too low. And of course, the reason why you want to do it this way is to avoid the person's sugar going down too fast, right? The thing about some person with diabetes is that some persons, I've met a number of persons who, when their blood sugar, because their body has gotten so used to their sugar being high, when they bring their blood sugar down to normal, they start feeling like their blood sugar is low. They start having symptoms of hypoglycemia, even though the sugar is normal. So some persons, they have to get used to their sugar being at that level. She shouldn't try to bring the sugar down too fast. Right. So that is something that you need to also do. And of course, so these are some of the things that they need to get before they start as well. This is part of the supplies that they'll have to get before they start the process. Get the supplements, but don't start them right away. And start it when they start, that the process of going through remission. Right. So apart from that, now each week they need to check on their blood pressure and their weight, right? To check the blood pressure and weight as well, right? Because this is something that can change, with what you're doing, especially with the keto diet. The blood pressure can come down quite quickly. The keto diet also, the blood pressure the blood pressure and the weight can come down pretty quickly. So you'd want to make sure that you monitor those readings, and it kind of helps to give the person motivation as well. To help them to stay on the right track, right? And it's important to keep on checking with them to see if they're having any challenges, right? Because life is life, things change. So make sure that you monitor how they are feeling with the whole process. If they are getting any challenges, that is very important because sometimes that can derail And sometimes some persons have some challenges, they may not be able to really see a way to overcome those challenges. But of course, which is why, the team approach is so important. And I just want to, again, say that the school platform is going to be critical. So anybody who you're working with, it's very important they join the school platform, right? It's going to be very, very important they join the school platform. And of course, so we're going to be letting you have a link so that persons who, want to join, not saying that this is a must, but it's going to be very difficult because, the resources are there. That is where the resources are, right? So anybody who doesn't join, it would have to be something like they don't have any internet access or something like that. But the school platform is going to be very, very critical in this process, right? So they'll get a link to join it, and they can get all the resources there and support as well. Because of course, what we want to do is let it be a team approach, right? Let it be a team approach to make it interesting, to make it fun, so that they can keep motivated, right? And if there are any challenges that they're having, then we can brainstorm, we can think about how you can help this. So we're going to be helping each other. We're going to be helping these persons as well, to go through this process, right? And from there on, it's monitoring of the the blood sugar reading. So you don't want to be ensuring that if any obstacles they are dealt with as early as possible, and just to remind the person about why it is that they want to achieve this, and just see each month how they're doing. So you have to keep in touch with this person on a regular basis, especially during the first week, first and second week. Once you know that things are going well, then you might need to check with that person once a week. So for the first 2 weeks, I would say every couple of days. And then after that, you may want to check on them on a weekly basis, just to see how things are going, and try to address any challenges that this person may have, right? And if making adjustments, not everybody will tolerate everything that is being recommended. So you try to address them based on the challenges that they are having. And the thing about it is that some persons have an easier time than others, right? Some persons have an easier time than others. So not everybody will need the same level of intervention. It really depends on what their individual situation is. All right. So I'm going to take a 3-minute break. When we come back, we're going to be just looking at some scenarios just to see how we can deal with those challenges if they should take place. Just 3 minutes.